This is Meldita again, and I'm back, and this is a continuation of our kidney transplant part 1. Okay, here at my YouTube channel, Meldita's Info Corner, my Facebook is johnregaccio@yahoo.ca. Okay, so we have two medical conditions that affect our kidneys. If we do not treat our type 2 diabetes or non-insulin dependent diabetes mellitus, and we do not treat our high blood pressure or hypertension, then these two medical conditions will damage our kidneys. For type 2 diabetes, not treated, a prolonged high blood sugar or hypoglycemia will actually lead to glycation or non-enzymatic glycosylation because there's a massive blood sugar attaching to the protein or glycoprotein, and that makes your protein useless. Okay. So with the combination of the blood sugar and the protein, you end up producing Amadori products, and these Amadori products will be converted to advanced glycated end products or H, very disastrous to the structure or to the kidney blood vessels, and that will cause thickening of the capillaries. There is a thickening and narrowing of this efferent arteriole. There is thickening and narrowing of the afferent arteriole, and the capillaries will clog up or close. Okay, there is a damage to the filtration barrier. There is thickening of our glomerular basement membrane. There is a leaky podocyte slit, so we lost the nephrin that supports our slits, so that allows the large chemicals to come out, even protein, because the slit process is no longer intact. Okay, and there is overproduction of mesangial matrix, which is the framework of all the capillaries, okay, to make them work better. But if they're overcrowded, then that affects the filtration. Okay, so the effect of this diabetes with high blood sugar is hitting the structure, followed by dysfunction, and at the end, kidney failure. Okay, for high blood pressure, there are medical conditions and risk factors that increase the blood pressure. For medical conditions, we have diabetes, kidney diseases, genetics, and so on, chronic kidney infection, renal artery stenosis. This will increase the blood pressure, but there are risk factors that are being done by people for a long time that increase their blood pressure. Smoking, salt intake, okay, their diet is rich in salt, obesity, sleep apnea, and stress. Okay, how will the damage work? With prolonged high blood pressure, for bigger or renal arteries, there is already atherosclerosis, but the high blood pressure will accelerate the atherosclerosis, make it worse. There's an increased elastic lamina, which is like the shock absorber between the layers of the vessels, and the bottom line, we have stiff arteries. The smaller arteries or the arterioles, they have arteriosclerosis that become worse because of increased blood pressure. Also, increased elastic laminae. There is an increased intimal cells, hypertrophy of smooth muscles, and collagen. So besides having stiff arteries, they're also prone to clogging up or closure. So with the stiff arteries, the pressure is high. We have increased intraglomerular pressure, and that eventually will damage our filtration barrier. So as you know, this glomerular area here, we have a dilated afferent arteriole and constricted efferent arteriole. With high blood pressure in here, it will damage this structure. These are full of capillaries. There will be a great damage until they become useless. Okay, they're no longer functional. So as I said, the effect is slow, gradual, but at the end, it's really terrible. Kidney failure. That is a gross problem at the end. Okay? So what are the signs of your kidney failure without telling people? They could tell by your blood works. There's a dropping estimated glomerular filtration rate. There's increased creatinine. There's albumin in the urine. They say that from the lab, or called proteinuria. Your urine is foamy, frothy, bubbly urine. Sometimes if it sits longer in the toilet bowl, actually there's a smell. There's swelling of the lower extremities. Your urine is declining. It used to be lots, then getting less and less and more. Okay, so the the effect of blood sugar or diabetes is structure followed by dysfunction and then total failure. The effect of high blood pressure is pressure will destroy the structure, then dysfunction and total failure. So if no glomerular blood flow, there's no glomerular filtration, then we have a kidney failure. So that means we got to be ready because you will be needing dialysis or kidney transplant. Okay? So that's about it, and I hope it helps a little bit, and thank you so much. And I will take a break because I will be, translating this in Tagalog, then proceed with the real kidney transplant video. But this is all my drawings, and it will again drawings for this coming video. Thank you so much.